not in your periods? In this video, today we are answering this question. So when you are a woman and you are experiencing lower abdominal pain, this could be an indication that there's something not right, because one thing we have to understand is that lower abdominal pain is brought about by many things happening to your reproductive system. When we take a look at the reproductive system, we have two ovaries here, and then we have the fallopian tubes. We also have this rounded structure. This is your uterus. The uterus is divided into three layers. That is the outer layer, also known as the perimetrium, the inner layer known as the myometrium, and then the innermost layer known as the endometrium. If you are experiencing lower abdominal pain and you are a woman, probably you are from 10 years up to maybe 40 years, this could be an indication that there's something wrong with your reproductive system. What you need to find out, or what you need to do, is go ahead and talk to your doctor. Your doctor will do some examinations on you. Your doctor will do some tests on you. And the test which will be done, the first test which I recommend to all my clients, all my friends, is that you need to do what we call a pelvic ultrasound scan. Pelvic ultrasound scan is a test, or it is an examination which is done in hospital where images are taken of your reproductive system. As you can see here, the ultrasound scan will show how your ovaries are, whether they have some swellings, also known as small cysts. Remember, we have talked about swellings or cysts on your ovaries in one of our previous videos. If you missed this video, please kindly go back and watch this video. After watching this one, go through our videos on this very channel. We've talked about a condition known as polycystic ovarian syndrome, and we have said that this is a condition whereby your ovaries have small swellings, and these swellings actually tend to interfere with your chances of getting pregnant. We are talking about the causes of lower abdominal pain, and we are saying that it could be an issue with your ovaries. You could be having this condition known as polycystic ovarian syndrome, or you could be having ovarian cysts. Polycystic means you are having small swellings which are more than 9. If you actually do the scan and your doctor tells you that you have small swellings which are more than 9, then we call that polycystic ovarian syndrome. But remember, polycystic ovarian syndrome is a hormonal problem. It is a problem brought about by your hormones not balancing, and then at the same time it's brought about by many changes happening in your body. Lower abdominal pain can also be brought about by free fluid in your fallopian tubes. We say that these two are your fallopian tubes, assuming that you have two fallopian tubes, because we have some of our friends who have only one fallopian tube and one was removed through surgery. So no matter the number of fallopian tubes you have, whether you have 2 or 1 fallopian tube, if you are feeling pain and this pain is localized on either your right side or your left side, there could be an issue with your fallopian tubes. You could be having a condition known as hydrosalpingitis, or you could be having adhesions or tissues in your fallopian tubes. How can you confirm that you could be having either hydrosalpingitis? Hydrosalpingitis means free fluid in your fallopian tubes. When you get a urine tract infection, you do not treat it very well, or you do self-medication. You go to hospital, take some 2 tablets, and then you think you've got better or you've healed. What happens is that this infection can ascend because your bladder is just beneath your uterus. It's actually anteroposterior. It is just next to your uterus. This infection can pass through the small tubes leading to your bladder, also known as the urethra, and then this infection can go upwards up to your womb. When it moves up to your womb, it causes a condition known as endometritis. Endometritis is when you have free fluid in your womb. How can you confirm that you have endometritis? You are having low abdominal pain, and at the same time this pain is being brought about by endometritis. How can you confirm? It is very simple. You just simply go and then do an ultrasound scan. Specifically, you do what we call a pelvic or gynecologic ultrasound scan, and your doctor will be able to explain all the findings for you. We've said that we are talking about the causes of lower abdominal pain. We've said that it could be an issue with your ovaries, it could be an issue with your fallopian tubes, and we have said that in your fallopian tubes there could be changes. Next, we've said that it could be an issue with your endometritis, or it could be an issue with your womb. Remember, in your womb, you could also be having masses or swellings. Actually, you could be having masses in your womb, and you're feeling low abdominal pain, you are trying to get pregnant, you're not getting pregnant, you are actually experiencing your abdomen increasing, and maybe your friends are telling you that you are pregnant, but you do the pregnancy test, it is negative. What is the cause of this? This could be due to masses. And remember, masses are named according to their location. We have those masses which are inside, the fibroids which can be inside, and those are called the submucosal fibroids. Sorry about that. Submucosal is S-U-B. This is the spelling. So the fibroids can be inside. When they are inside your womb, we call that submucosal fibroids. And then they could be in between your layers of the myometrium. And specifically, when they are inside, remember we've said that when they are inside, we call them submucosal fibroids. And then we also have the subserosal fibroids. They could be actually subserosal, meaning that they could be located in between your layers or your myometrium. They could also be pendiculated. Pendiculated means it comes out of your womb, or the fibroid increases and then it grows outside your womb. It gets attached, just like you can have a branch being attached on a big tree. So specifically, when this fibroid is attached onto your womb and then it is growing inside your abdominal layer, then still it can cause pain, and the only way to confirm is by doing a pelvic ultrasound scan. Gerard Massa, the health educator, is the name of the channel. I welcome you, my friend, on our channel. If it's your first time here, we talk about fertility. It is a fertility-based channel whereby we address issues preventing you from getting pregnant. I know that when you watch our videos, you'll get one video having that tip you've been waiting for, you've been looking for. So remember, you can get pregnant, but the key is you need to identify what could be preventing you from getting pregnant. We are proceeding with the causes of low abdominal pain. We've talked about the ovaries, we've talked about the fallopian tubes, we've talked about your womb, either having free fluid, also known as endometritis, or masses growing inside your womb, also known as fibroids. The pain could be due to fibroids. You could be having lower abdominal pain when you go to urinate. Well, actually, when you go to urinate, sorry about that. So when you experience burning pain, or when you experience pain when you are urinating, then you could be having a condition known as cervicitis. Cervicitis is a term, it's a name, it comes from the word cervix, whereby your cervix can be affected by the free fluid or by the UTI, which started off from your bladder and then it moved upwards. So as it is moving, ideally, when a woman is not pregnant, what happens is that the cervix is always closed. It only opens during ovulation, that is on the 14th day. When you are about to get pregnant, it opens to allow the male sperms to go through. Immediately fertilization takes place, it closes again. So ideally, your cervix is supposed to be closed. So if it actually gets affected by an infection which is moving upwards, it can swell, it can enlarge, and then it can be very painful. When you are experiencing this, you need to go to hospital, and your doctor will request for some tests. Still, a pelvic ultrasound scan will be requested because it is a standard for all women. I always tell this to all women, all my clients. I tell them, before you do any other tests, it is very imperative that you begin with the pelvic ultrasound scan. When a pelvic ultrasound scan is done, it can show images of your cervix. Measurement of the length of your cervix will be taken, and then also your cervix will be actually visualized. Your doctor will be able to see your cervix, whether it is having some free fluid in between. Because when we take an example of maybe this being your cervix with a small canal in the middle, you realize that when free fluid, or when free fluid, okay, basically when a UTI enters into your cervix, it is going to cause accumulation of free fluid inside your cervix, because the cervix has two parts. It has the internal part and then it has the external part. So when the ultrasound scan is done and you are having cervicitis, the scan will show that there is some dark liquid. In the language of scan, in scan language, we call it, you could do, actually, there will be an echoic free fluid. You'll see that on your report. Your doctor will make a report and then say there's an echoic free fluid noted in the intercavitary space. Specifically, in simple terms, your doctor will confirm to you that you have liquid, you have free fluid which is collecting around your cervix. And of course, also you'll be noticing that there's that discharge which is not good coming out of you. There's a very bad smell coming out. And then of course, when you try to get pregnant, normally it becomes difficult. Even if fertilization takes place and you get pregnant, there are high chances of the pregnancy ending up as a miscarriage. Remember, we have said that among the leading causes of miscarriages, normally UTIs which are moving to upwards in your womb are among the leading causes. There are other causes like stress, like working a lot, carrying heavy things, and then of course not having enough bed rest, and then of course even taking some drugs. These can cause miscarriages, but among the leading causes, urine tract infections are among the leading causes. We've been talking about the causes of lower abdominal pain. This is the Fertility Show with Gerard Massa. On this channel, we do talk about pregnancy. We talk about the tips on how you can get pregnant faster. If it's your first time on our channel, I welcome you, and remember to go to our website. It is www.gerardmassathehealtheducator.com. That's www.gerardmassathehealtheducator.com. Come check out our website. We are doing lots of work in the community. We need your support. Support us by donating to our channel. Support us by donating on our website so that we can reach pregnant mothers with free ultrasound scans in the community. Your donation means a lot because we shall use it specifically to get the equipment for us, to enable us actually to get the equipment like ultrasound scans so that we can go to the community and then offer free ultrasound scans to our pregnant mothers, those hard to reach mothers who are in villages, so that we can reduce the number of mothers dying as a result of giving birth, dying as a result of complications arising from not having an ultrasound scan done. So with your support, I believe we shall reach all these mothers. Just go to our website. Any amount is welcome. You can donate anything, even $1 is welcome. Gerard Massa, the Health Educator, from gerardmassathehealtheducator.com is our channel. I welcome you. Remember to come back tomorrow for another video. I will be uploading more videos. We upload videos every day at exactly 8 a.m. and also at exactly 17 hours. That is at exactly 800 hours, and then also at 17 hours in the evening, we do upload videos about fertility. Remember, I can also talk about your question. If you have any question you would like me to do a video about, please just leave it down below in the comments. I will do a video on it. I will answer all your questions, and at the end of the day, we are praying for you that you also do get pregnant. Remember to put God first. We can give you this information we learned, they taught us, but you need to put God first in everything. Have yourself a fantastic and healthy day. Bye-bye. Bye-bye. Like to check if at all you are fertile or you are not fertile. The tests for fertility. What investigations can be done to determine fertility? Gerard Massa, the Health Educator, is the name of the channel. I welcome you for today's lesson, and we are talking about the tests you can do to check your fertility. So, without further ado, we are talking about the tests you can do to check your fertility. We have said that when you would like to know whether you are fertile or you are not fertile, there are some special tests which need to be done. The tests we are talking about here, both are radiological and they are serological. When I talk about radiological tests and serological tests, specifically we are talking about testing for fertility, whereby X-rays or scans can be done on your system. And stay with me, we are going to talk about the specific blood tests, the specific X-ray tests which will be done on you. So If you would like to know whether you are fertile or you are not fertile, the first very important test that will be done on you is to do what we call a fertility hormonal screen test. The first test for fertility is what we call the fertility hormonal screen test. When we talk about the fertility hormonal screen test, this is a test which is done to check or to assess your hormones to see whether they are within the normal ranges or they are not within the normal ranges. If you are a couple, you have tried to get pregnant and things are not working out, it is high time you do a test. You check your hormones to see how they are, whether they are within the normal ranges or they are not within the normal ranges. And the first test or the first hormone we shall look at is what we call progesterone. When you would like to know whether you are fertile or you are not fertile, it is very important to know the levels of a hormone known as progesterone. We shall talk more about progesterone later on as we proceed. And the next hormone is what we call LH or luteinizing hormone. And then the next hormone is what we call the follicle stimulating hormone. Next hormone is known as the E2 or the estradiol. E2 or estrogen is a hormone which is actually produced by your egg cells. What happens is that in your brain there's a part known as the hypothalamus. There's a part in the brain known as the hypothalamus. The hypothalamus tells the anterior pituitary gland, abbreviated as an APG. It is the hypothalamus, a part in your brain which tells or which stimulates the anterior pituitary gland to produce the two hormones. The first hormone is known as the FSH, and then the next hormone is known as LH. So the anterior pituitary gland the hypothalamus stimulates your anterior pituitary gland, and then the anterior pituitary gland will produce two hormones. The first hormone is known as FSH. FSH in full, it means the follicle stimulating hormone, or it is the hormone which stimulates your eggs so that they grow. Just like you can put a seed in soil, just as you can plant a seed in soil, and then you water it, you apply manure, you do everything to make sure that the seed grows. Specifically, what is responsible, or the hormone which is responsible for this function, is what we call the follicle stimulating hormone. So if you would like to know why you are not getting pregnant, why you are having issues getting pregnant, you've taken all the drugs and things are not working out, it is high time you discuss with your doctor about testing for hormones. Because what happens is that you cannot just show signs, you cannot sit there and see that maybe this hormone is not balancing. What you need to do is you need to do a blood test to check for these hormones. And when we are to explain something here, very brief, you realize that when these two hormones have been produced, that is FSH plus LH, when they have been produced, they are going to travel to your gonads, or they are going to travel to your ovaries. And when FSH and LH reaches your ovaries, assuming this is an egg cell, or assuming the ovaries have produced an egg, there's going to be changes which are going to take place. We said that FSH and LH are produced in the brain. When they travel through the blood up to your ovaries, they are going to act specifically on an egg, or they are going to act on your egg. So when FSH and LH act on your egg, the end result is going to be that two hormones are going to be produced. The first hormone is known as progesterone. And then the next hormone is known as estrogen, or abbreviated as E2. So when FSH, that is when the follicle stimulating hormone, acts on your egg, there's going to be release of estrogen. FSH brings about the release of estrogen, whereas LOH, known as luteinizing hormone, acts on your egg and then it brings about the release of progesterone. Now, estrogen is very important because it plays very many roles. It prepares your womb, it prepares your uterus, it brings about the thickening of your uterus so that when implantation happens, implantation becomes successful. So that when the egg attaches onto your womb, there's going to be growth which will take place. When you have low estrogen or when you have a dysfunction in the levels of estrogen being produced in your body, there's going to be pregnancy difficulties. You could actually end up with infertility. And then when progesterone has been released, this is normally in the luteal phase of your menstrual cycle. That is, immediately after ovulation has taken place, progesterone is going to surge. It's going to increase in its levels. And if at all this is your womb, if this is your inside of your womb, progesterone being released in your uterus is going to make sure, or it's going to make sure that when the egg has attached onto your womb, the egg grows into, actually the fertilized embryo grows up to that formation. It grows into a successful pregnancy, in simple terms. So what brings about a successful pregnancy in your body, if at all you have undergone fertilization, is this hormone known as progesterone. Progesterone is a pregnancy-friendly hormone. It makes sure that your pregnancy goes on to become successful. If you have insufficient progesterone hormone, then there's going to be repeated, or there's going to be miscarriages which will be repeated. Miscarriages mean, or to have a miscarriage, it means basically you are not able to carry a successful pregnancy beyond 20 weeks. So if you have tried to get pregnant, you are a couple, you've taken all the drugs, you've taken Clomid, you've taken letrozole, you've taken all the fertility drugs, but things are not working out, you have an issue of unexplained infertility, then it is high time you do a fertility hormonal screen test. And after doing the fertility hormonal screen test, your doctor or your specialist will be able to interpret for you your results and then, of course, give you the best remedies, the best treatments, the best thing on the results of your hormones. You can also have a private chat with me on my channel www.gerardmassa.thehealtheducator.com, and we shall share more about how you can get pregnant faster naturally. We talked about the other tests of fertility, or to check whether you are fertile or you are not fertile, and we said that the next test is an X-ray test known as the HSG, and we said that the HSG test specifically, it means the hysterosalpingogram. HSG means hysterosalpingogram. The hysterosalpingogram test is a test whereby they will check for your fertility. They will get a chemical or a dye, a contrast media, which will be introduced into your private part, your V, and then this chemical goes upwards into your womb and into your fallopian tubes, and then when it reaches your fallopian tubes, where there's a blockage either due to free fluid or adhesions, then it will collect there. Results or pictures will be taken, and then where this contrast media or where this chemical has accumulated, that is the point of blockage, and then the report will show where the blockage is. Your doctor will, based on that, to give you the best care, whereby they may do tubal unblocking in the theater by doing a simple procedure also known as a laparoscopic operation. So we are proceeding with our tests, and we have said that we've talked about the blood tests, whereby we said that your hormones can be checked in your blood. We also said that X-ray tests like the HSG scan can be done. There's also another special test known as the hysterosalpingogram. It's also very important. And then the next test which will be done to assess your fertility is what we call the pelvic ultrasound scan, whereby more attention will be given to your ovaries to your ovaries to see what could be happening with your ovaries. When we do this pelvic ultrasound scan, if at all this is your ovary, there's going to be follicles which will be seen. Follicles are those shells where the eggs are kept. So ideally, you are supposed to be having a dominant follicle, which is also known as the Graafian follicle. That is, when you do this pelvic ultrasound scan on the 14th day or when you are ovulating, you'll be able to see a dominant follicle which is actually getting ready to rupture, which is actually getting ready to undergo ovulation. If you do the pelvic ultrasound scan on your 14th day, that is on the day when you are ovulating, or the day, actually you can do it on the 13th day. When you do it on the 13th day or even the 14th day, and basically we are supposed to be seeing a dominant follicle, and your scan shows that there's no dominant follicle, you do not have actually an egg which is going to undergo ovulation, then it means you could be having issues with ovulation. And that's when we need to correlate the results of the pelvic ultrasound scan test or the pelvic ultrasound scan with your progesterone levels. Remember, progesterone increase means that implantation is actually taking place, or it has taken place. Gerard Master, the Health Educator are my names. Remember to subscribe to our channel. If it's your first time on our channel, I welcome you, my friend. You are most welcome on our channel. Watch all our videos. I believe you'll get a video which will give you the tip you've been looking for in regards to fertility, in regards to getting pregnant faster. Next test is what we call the urine culture and sensitivity test. Urine culture and sensitivity test, a sample of your urine will be taken, whereby results will come out, and these results will show whether you have been having an infection. For example, if you are having chlamydia or you are having trichomonas organisms in your system, in your urinary system, then these will be treated, and then you'll be able to get pregnant faster. When we talked about the pelvic ultrasound scan, we forgot to talk about PIDs. When there's free fluid in a part of your womb known as the pouch of Douglas, and then you have lots of free fluid in that part, then there are high chances that you could be having a pelvic inflammatory disease. Have yourself a fantastic and healthy day. I look forward to talking with you on my channel. Just go down below this video in the comments and then ask me all your questions. I will answer all your questions in regards to fertility, in regards to how you can get pregnant faster naturally. You can also visit our website. We do offer free ultrasound scans to all the most vulnerable pregnant mothers in our community, and we are looking for your support so that we can reach more of these pregnant mothers. So you can support us by donating on our channel. You can support us by donating on our website. Any amount is welcome. Whatever amount you donate will be directed towards reaching out to all the pregnant mothers so that we can share with them this information you are getting here. Have yourself a fantastic and healthy day. May God bless us all, and take care. Bye-bye. How to get pregnant faster with one fallopian tube. How you can boost ovulation with a simple recipe. Did you know that you can get pregnant faster with one fallopian tube? Did you know that you can boost ovulation? You can boost your chances of getting pregnant with just a simple recipe, with something very simple that you have it even in your nearby market. Yes, in this video today we are going to talk about how to get pregnant faster with one fallopian tube. And yes, if you are new here, you are most welcome. I welcome you to our lesson for today, I welcome you to this channel. On this channel, we talk about the ovulation calendar, we talk about the ovulation calculator, and then we do also give pregnancy tips on how you can get pregnant naturally. Gerard Massa, the health educator, is the name of the channel, and I welcome you, my friend. Stay with me, watch this video to the end. We are going to talk about how you can get pregnant faster with one fallopian tube and how you can boost ovulation with just a very simple recipe. It has worked, it is working for many couples, it will work for you to watch this video to the end, and we are going to talk about all this after this short message. Don't leave. Thank you, my friend, for staying around. We are talking about how you can get pregnant faster with one fallopian tube and how you can boost ovulation with just a simple recipe. So what is happening is that we shall begin by understanding the ovulation calendar. Whenever you would like to know, whenever you want to know the days you are most likely to get pregnant, remember you only have to count from the first day when you saw your periods. If you start seeing your periods on maybe the second day of this particular month, then remember you can easily get pregnant very easily. Thank you, my friend. So we are talking about how you can get pregnant faster by first of all understanding your ovulation calendar. The most important thing is that when you are calculating your ovulation day, you always have to begin from the first day when you have seen your menses, and then when you begin counting from the first day when you saw your